Hello, welcome to Senior Connections. This is our monthly television show that looks at all things related to older adults, their needs, the caregivers that surround them, and it is brought to you by Senior Resources, which is your area agency on aging, serving adults 60 years of age and their family and friends. We're here every month to try to navigate what can be a confusing network of services and programs for older adults, and every month we try to focus on something else. It might be Medicare, it could be health benefits, it could be services for caregivers, it could be pharmaceutical issues. And so this month, I'm very excited to welcome for the first time Ben Bringedahl, who is a pharmacist and the area healthcare supervisor for Walgreens. Thanks for joining me, Ben.
Thank you.
Happy
Glad
to
be
have
here.
you. So we're going to talk a little bit about all things pharmacy. That's we could talk well over a half an hour about that, I'm sure, but we'll condense it into 30 minutes. So first of all, tell our viewers a little bit about you. What made you decide to become a pharmacist?
Sure. Well, you know, I always knew when I graduated from high school I wanted to do something health-related. I had some relatives that were pharmacists. My uncle owned his drugstore. When I was a kid, I used to visit once in a while, and what really kind of pushed me into it is my brother-in-law was a store manager at a Walgreens store, and he talked to me and he says, you know, you really should consider pharmacy, and he kind of got me in the door at Walgreens as an intern, and from there it just turned into pharmacy school, and I went to Ferris State University, graduated in 1996 with a bachelor's in pharmacy, and the rest has been working at Walgreens for the last 25 years.
So Walgreens has really been in your blood since you were young, it sounds like.
It has. You know, I've worked there for, it was 25 years this last November. My wife is also a pharmacist and also works for Walgreens, so we kind of have the family at Walgreens.
So now I have to ask, did you meet her in pharmacy school?
We met before pharmacy
Okay.
school, so we kind of decided that path somewhere in the school time to decide to go to pharmacy school together.
So what is involved in getting a degree there? I know that many pharmacists in Michigan have gone to Ferris State. It has
Sure.
a wonderful, well-known pharmacy program, one of the, certainly I think the top in the state, if not one of the top in the country. What's involved in that, though, for
Well,
everybody?
right when I went to school back in 1996, it was pretty much a 6-year program, a Bachelor's of Science program, so 2 years of pre-pharmacy school in the medical sciences, and then you went on and did the 4 years of just the pharmacy school itself. Now it's become a doctorate degree, so it's really almost a 7-year degree now.
Oh, wow.
So our students that are coming out of pharmacy school in all the schools across Michigan come out as a doctorate. They get a doctorate degree of pharmacy, so they're considered a doctor.
I wonder, that's news to me, so I have to think that a
Yeah.
lot of people didn't realize that. So I know that one of the reasons we asked you here is that Walgreens and our national association, which is N4A, or the National Association of Area Agencies on Aging, which is a mouthful, have partnered in previous years, and you were at Senior Resources a couple of years ago, to provide answers on aging pharmacy benefits information. And I remember sitting in that session, and I learned an awful lot about it. So we talked about Medicare prescription drug plans then, I think, but, and that's what we'll talk about a lot today, but I know that it can also help. The information you have or that pharmacists have can help anybody who's got, whether it's a retiree health plan or something else, isn't that right?
That is correct. You know, pharmacists can play a vital role in helping seniors reduce their medication costs. And, you know, the program that we partnered with you guys on before when we created this was called Maximizing Your Benefits, and that's something that we feel that working with your pharmacist, you can truly maximize your Part D benefits through Medicare, and that's really what it was all about.
So let's talk a little bit about that, about why we need to maximize those benefits. I remember you sent me some good information. There was a study that showed that 88% of people said that they could use some help to lower their costs. So let's talk a little bit. What kind of savings can you help people find?
Yeah, I mean, the average senior, if they really understand their benefits through Medicare Part D, you know, we've had a variety of studies done over time, and you know, it's been anywhere from $200 up to $1,000 a year that seniors could potentially save on their medications. And of course, it always depends on how many medications they're taking and what types of medications there are. But I believe the pharmacist, working along with the physician and the patient, can certainly save money if they work together.
So a pharmacist is really a critical part of a medical team. Anybody who's got any kind of a prescription should view it that way.
100%. Yep.
So when people can't afford their medications, what kind of issues do you see with them?
Yeah, that's the biggest challenges right now with the seniors. They're on limited incomes. Everybody knows that. Oftentimes, to save money, they will conserve their medication. So in other words, sometimes, let's say they're on a blood pressure pill or they're on a cholesterol medication, they have a $20 copay, they get a month's worth. They know they need to make it last longer than a month, so they either take a half a tablet a day or take it every other day, and that can lead to some serious health consequences for the patient. The other big challenge we see is they tend to use more than one pharmacy because they try to find, in no fault of their own, they try to find the pharmacy that offers them the lowest cost.
Right.
The problem with that is then the pharmacist sometimes loses the ability to manage potential drug interactions, and you get that where the pharmacist doesn't have the total view of the patient's prescription file, and that can lead to some dangerous interactions.
I would imagine. I would also think that if you've got some, say, Sue Jones is coming in has a prescription for, like you said, that blood pressure medication, and she's supposed to get it every month, every 30 days, and I know that when we have prescriptions, we get a reminder from our pharmacy about that. And you see that she's coming in every 45 or every 60. Would you ask Sue about that?
Absolutely. There, many pharmacies have different types of reporting that can show a patient's taking their medication correctly or not. They have some call lists that can say, hey, call Mrs. Jones because she's 5 or 10 days late on getting her prescription filled. And we can identify some of those issues. And hopefully, the pharmacist can play a role in finding a medication that's cheaper if that's truly the reason they're not taking it properly.
And do you find, if you've had to do that, are people generally honest with you about that?
Sometimes they are, sometimes they're not. It's all about the relationship with your pharmacist, and I know we're going to talk about how to choose a pharmacy later, but I think that the pharmacist relationship with a patient is critical. You should be able to trust your pharmacist like your doctor.
Right, it sounds like it. Do you think most people fully understand what their pharmacy benefits are? It can be confusing.
It is confusing. It's even confusing for pharmacists. The insurance industry is very difficult to understand, let alone when you have a senior trying to choose from a bazillion different plans. Right. There's a couple other studies that we did out there that 1 in 5 just do not understand their medical benefits at all. So, that was part of the purpose that we worked together to put this presentation together, because hopefully as we go through, we'll give some education so they can understand how to maximize their benefits.
Well, I would hope that this will help. And we will put it on our website eventually, too, so that it can be shared anytime during the year. But let's talk terminology, because that can be confusing. So there's a few key terms I'm going to run past you. Premium.
Premium is simply your monthly bill to have the insurance.
Okay.
It varies from plan to plan, and it's something that a senior, when they're choosing a plan or having somebody help them choose a plan, they need to know what that monthly fee is going to be to have that insurance plan.
Okay, so that's step one. Then they may have a deductible.
Yep, the deductible is always a big challenge, because plans tend to cost less on their premium if they have a higher deductible. So sometimes the premium looks really good, I can afford that one, but then when they go to the pharmacy, they find out, I don't get to start paying my copay until I meet my deductible, which means I pay full price for the medication until I hit the deductible.
Right. And copay is the next one. Copay or co-insurance?
Yeah, it used to be insurances for the pharmacy was always just copay. It was a set dollar amount. Copay is what you pay for prescription. It's your cost sharing piece of what the insurance doesn't pay.
So I think I have a $15 and a $15 generic, $30 brand name.
Perfect. Those are your copays. And now there's a new thing called co-insurance, where it's more of a percentage. You pay a percentage of the cost of the drug that the insurance doesn't pick up. So it's not an even amount, like 15 or 30. It could be, $23.80, because that's part of the cost of the medication. And that can be checked into as the patient's looking for what plan they want to choose as well.
Okay. So really, premium, deductible, copay, or coinsurance are all monetary things that people need to be looking at and trying to get, if they don't understand it, getting somebody who can help them figure out what might cost them more or less over some time.
Exactly.
Formulary.
Formulary is the most critical piece of selecting a plan for a senior. This is the part where I think a pharmacist can play the biggest role. And also, this is the part that confuses, I think, most seniors. When you sign up for a plan for Medicare Part D, they send you a packet which typically has the formulary. If they don't, you can always call the service number on the back of the card and ask for a formulary. What a formulary is, it's a list of drugs that the insurance company covers. And typically it has tiers. Tier 1, I've seen all the way up to Tier 6. Doesn't matter how many tiers there are, just to know that the Tier 1 drugs are your cheapest alternatives. And like we'll go back to the blood pressure or the cholesterol medications, typically there's multiple medications that do exactly the same thing. They're just made by different companies, and they're in different tiers. And that's where a pharmacist can play a valuable role with a senior. If the senior wants to bring in their formulary and sit down and talk to a pharmacist and say, hey, can you look at my profile, that's the list of medications the patient's taking, and let me know, is there an alternative that's cheaper that does the same thing for me? And then once that's identified, the pharmacist can place that call to that doctor and say, hey, you know, we need to help this patient save some money. If the doctor, it's always up to the doctor if they want to choose to switch the patient. But typically, if it helps promote adherence, and we'll talk about adherence in a little bit, the doctor's going to go for it. Right. It's better to have them take their medication every day like they're supposed to.
Than it not be the 100% what they thought was.
Absolutely.
Was
Absolutely.
So, and we probably need to revisit this a little later because I want to go on to one last term, I think. But I would imagine that there is a lot of work involved in keeping up with all of these drugs. And it's not like you just went to school and now you never have to study again. For you or for the doctors, because it's changing all the time.
It changes all the time. There's new drugs all the time. You know, there's a lot of continuing education that goes into it.
And you have to know they're on this drug, so this one might not work, but this one does.
Exactly.
We'll talk about that.
Exactly.
One more term, preferred pharmacy network.
Yeah, preferred pharmacy network is another big piece that seniors can make sure that they're saving the most. And how that works is the insurance companies have preferred pharmacies within their network. What that means is if you use a preferred pharmacy, you potentially will have the lowest possible copay. If you have a plan and you're not using the preferred pharmacy, you're going to be paying more. Okay. So a big thing that a senior needs to do when they're getting ready to choose their Med D benefit, if they love their pharmacy they're going to, they need to ask that plan, do you have a preferred network and is my pharmacy in it? Because if they choose a plan and that ends up their favorite pharmacy's not, more than likely they're going to have to switch because they're going to be paying an awful lot more at that pharmacy.
So it's the same thing as what happens sometimes if you switch insurance and you have a preferred provider.
Exactly.
So sometimes you have a doctor who's in that, and otherwise you have to switch.
Yep, exactly. And again, that's a simple thing that a senior can do is call that number on the back of their card and say, hey, first of all, are you a preferred pharmacy network, and if so, what pharmacies are in that network?
Right. And they can do that because we just went through open enrollment, mid-October to mid-December. But if anybody watching is getting close to 65 and getting Medicare for the first time, these are good things for them to remember.
Exactly.
Otherwise, you've got that chance again, late fall. It comes mid-October through about the first week of December where there's open enrollment and anybody can change. So these are all really good questions for people to ask. So even though we're a ways away from that, January is just always a good time to remind people and be thinking about these kind of things. So let's talk a little bit more about pharmacies in general. What should somebody look for in a pharmacy besides that preferred, whether they're in that preferred network, if that happens?
Sure, I think the biggest thing that if I, speaking from me as a pharmacist, and if I was a patient for even my mother to choose a pharmacy, I would want a pharmacy where the pharmacist is accessible. We talked about that relationship with your pharmacist. We want to have that patient talking to the pharmacist about their medication. So making sure, number one, that the pharmacist is truly wanting to be part of their health care and willing to talk to the patient. That's number one. Number two, I would look at the pharmacy in terms of the services they offer. Do they offer more than just filling prescriptions? So things like services that can help my life easier, like things like that refills automatically and text messaging to remind you that you can get your refills or if you're late to refill. Services like providing immunizations when you need an immunization. And then probably the third thing would be convenience. Are they open the hours you need them to be open? Are they close to you? And then in some cases, delivery. I mean, if you're not able to get out, I mean, do they offer delivery solutions, things of that nature?
Or is there a drive-through?
Or is there a drive-through?
We're in winter.
Absolutely.
We don't always want
Yeah,
to
for
get
sure.
out of. I did that yesterday. I went and picked up, and there were 2 cars in the drive-through, and I thought, oh, I'll go inside, and then the line was longer, and
Yeah.
I really regretted that decision.
Yeah.
But that makes a lot of sense. So,
Yeah,
and you know, we've got some that are open 24/7,
Sure.
and then some of them
Yeah.
that close their doors at 7 or 8, or and you know.
And some people, believe it or not, need the 24 hours, so they're still out there.
Well, a lot of times, I've very rarely, fortunately, had to be involved with an emergency room thing, but sometimes that's when you get a prescription, and my neighborhood Walgreens is open 24
Yeah,
hours.
yeah.
It becomes very convenient.
sure.
So back to the formularies, what do they need to look for in their medications, and how can they save in that? Is that really where you're going to be more expert? I mean, I think people don't have as much time with their doctors as they'd like, or they're reluctant to ask them. So it seems like you would be a really logical person to look at that with.
And I think that's where the pharmacists are truly the most underutilized. You know, you don't have to make an appointment. You can walk in anytime they're open and generally speak to them. Now, certainly they're going to be busy at times where they may have to say, hey, can you come back at this time, right? You know, but yes, you're absolutely right. First of all, pharmacists are, you know, we talked about their education. They are clinical drug experts, so they can find a drug on your formulary that matches something you're taking that potentially is a lower cost. They also can be that conduit between you and your doctor. You know, some patients would not feel comfortable saying, my pharmacist told me to take this, so I'm going to call my doctor and tell him I want that. The doctor might not respond to that, but if you have a pharmacist that has that relationship with a physician that, you know, in your best interest will get you on a medication that will cost the least and allow you to take it every day like you're supposed to.
Right.
And I think that's the big piece of that. Bringing your formulary with you to the doctor's office is also another good practice, because physicians, there's no way a physician can memorize the formularies for the 500 different plans out there, right? So let's say the doctor's going to put you on a new medication. If you're in the doctor's office and you have your formulary with you, he can look at that formulary and say, hey, let me select this one. This is going to work exactly the way we need it to, plus it's in a lower tier for you.
So usually you're recommended, and especially older adults, you go to your doctor's appointment, bring your list of your prescriptions with you, because you could be going to a specialist who doesn't know that you're getting that blood pressure medication when you're going to work on your hip. So you should not only bring your list, but your formulary, so they can see where that is and they can be your partner with that.
Correct.
But if you don't do that, then your pharmacist. So if a pharmacy is open 12 hours, are there usually more than one pharmacist at a pharmacy, so there's almost always somebody there?
It depends on the pharmacy. Sometimes you run 12-hour days. It's one pharmacist, open to close.
Wow.
You know, speaking for Walgreens, we minimize that because of quality, but most of the time there's 1 or 2 pharmacists on staff. Over the course of the day, the pharmacy's open, depending on the business.
So much of the time when you go, you're not necessarily talking to the pharmacist, because the person who's checking you out could be a tech, or I don't know what else. What other positions are there in a pharmacy?
Yeah, during my some of these presentations I've done in the past, there is some confusion of who's who in the pharmacy back there.
Because they all wear lab coats.
Yeah. There's technicians. Anybody that usually waits on you is either a technician, and some pharmacies just have cashiers. Okay. But it's usually cashier, technician, or pharmacist. Usually the pharmacist has the lab coat on. The technicians are in scrubs, depending on the pharmacy that you go to. I think the biggest thing that you would want to let the seniors know is if they truly have drug questions like, hey, I'm having this side effect, I have this problem, they need to ask to speak to the pharmacist.
Don't assume the person you're talking to can help you with that.
And not to say that some of the technicians cannot handle some of the questions. If you want to really get that relationship with your pharmacist and understand, you need to ask for the pharmacist.
Perfect. That makes a lot of sense. So once you know your medications are the best for you and on the lowest tier, what else should somebody look for if they're trying to save?
I think the biggest thing that they need to do is keep in mind the preferred network piece, making sure there's a lot of plans out there too. If you get 90 days worth of your medication, sometimes there's a cost savings there. There are plans that if you get 90 days, some of them will give you, if you got 30 days, you'd pay 3 30-day copays, but if you get 90, you only pay 2 of those
Okay,
copays.
that's significant.
So sometimes there's a significant savings with 90 days. Again, that's a service that your pharmacist should be able to offer, to call the doctor and say, hey, can we fill this prescription for 90 days to save this patient some money?
So it not only is actually looking at every little dollar you can save, it's going to save you a trip to the pharmacy, save you your time. When we're in winter, the risk of going out, it really could be beneficial in a lot of ways.
And 90 days is also, there's, you know, we talked about adherence earlier, and adherence is making sure that patient takes the medication the way they're supposed to. Getting your prescription filled for 90 days is well proven that the patient takes it more on a regular basis.
Oh, really?
Yeah,
That's very
because they only have to go to the pharmacy every 3 months.
Mm-hmm.
You know, instead of making that trip, like you said, they might not want to go. It's bad outside. I'm going to skip a few days of medication.
Mm-hmm.
Yep.
Makes a lot of sense. What about over-the-counter drugs, Ben?
Yeah, over-the-counter drugs there's so many things over-the-counter, especially when you start getting into some of the vitamins and herbal supplements. There's a ton of drug interactions with those products. If you're on multiple medications for blood pressure, diabetes, cholesterol, and you're going to select an over-the-counter product, it really deserves a consult from a pharmacist.
Okay.
Some of the herbal supplements can really interact with a patient's prescription medications, either causing it to work more than it's supposed to or causing it to work less than it's supposed to. The pharmacist has the knowledge to get that drug interaction under control and allow that patient to take the right medications. So,
And there's all that fine print that comes with it that probably very few of us read, that
Sure.
probably tells us all that. The one I remember is, and it's not exactly the same, but with a lot of cholesterol medications, you shouldn't have grapefruit or grapefruit
Yep.
juice with it. But so, and I imagine some herbal supplements could definitely relate to that.
Absolutely.
But there are other things that, you know, if you're taking something for blood thinners, I'm sure there are, you know, and if you've had a stroke, there's a good chance that you're on something like that. So,
Absolutely.
So really then, if you're on any kind of a medication and you're looking for some pain reliever or something. And now there are a lot of things that were over the counter 5 years ago that aren't. They're behind the counter now you have to ask for.
Yep, for sure. And we're seeing more and more things go over the counter that used to be prescription. The good thing is those are generally typically safer, less drug interaction drugs in the pharmacy, but it's always worth running the question by your pharmacist, does this interact with the medications I'm on?
Good.
Yeah.
What about transition of care supplies?
Yeah, transition of care supplies, you know, a lot of times when seniors are discharged, say they had an event and they were in the hospital, they need some over-the-counter products. It's always a good place to go to the pharmacy and ask where they can get them. Not all pharmacies carry some of those things. Some of those products are durable medical equipment things. They have to go to certain pharmacies to find those, especially if they need to be billed to insurances. So pharmacists can be a conduit to get them to the right place to find those.
So it might not be something that you handle at that pharmacy, but they're going to help you find a place and probably have an idea of what the pricing is and some of those things as well. So what other, I was going to talk a little bit more about pharmacists. They don't just count out the pills. So talk to me a little bit more. I know we talked about your education, but you were saying when we were talking earlier before the camera started rolling that it's changed a little bit. So now we've got, you know, they're actually getting the doctorate. How many, I guess, what is the continuing education that you have to go through? Are you required as a pharmacist to get a certain amount?
Yes, we are all required, and it varies from state to state, but we're all required to have continuing education, including live pieces, so it's not just reading books or doing that type of thing. It's actually getting some live CE. So yes, we have to continue to stay educated up on the new medications that are coming out and any other thing that comes out in pharmacy.
So is there a certain amount, I mean, do you have to actually go back to college and take courses, or?
It's 30 hours every 2 years.
Oh, wow.
The license is renewed every 2 years, and that's what it is currently right now, and 10 of it has to be live.
Okay. So one of the things that we didn't talk about before, but that you hear about all over the country, and it's not just for young people, the opioid epidemic. Let's talk just a few minutes about that.
Sure.
It seems like that can be a big problem with older adults. We get older, we've got more aches, we've got different things going on, we've got more medications. Pharmacy shopping isn't just about convenience sometimes.
No, it's not. It's not. A lot of times, the pharmacists are put in a position to where they have to be kind of that safeguard. Is that prescription legitimately prescribed? Is it being used for the proper things? And sometimes the pharmacists have to get involved there. But the bigger thing, the pharmacist's role is making sure that the patient's getting the right amount of the medication. Is the dose too high? Could this cause an overdose situation? And a lot of pharmacies now are starting to carry a product called naloxone for overdose. And we've seen some things in the media lately. Opioid abuse actually causes more deaths in this country than car accidents. So, and a lot of it comes from this. The seniors get prescribed the medications for whatever ailment. The biggest thing that seniors need to know is that it has to stay out of reach and out of the hands of other people. Because there are some studies out there too that show that the people that typically get in trouble with overdose or get addicted were never even prescribed the medication.
Right. So it's a love.
They got it from grandma or grandpa's medicine cabinet, and that's a big piece.
And so I'd imagine that what would be helpful in that would be a locked situation, but then sometimes some of our older adults struggle with that kind of a situation.
I think a big thing for our seniors to do is when they're taken off a medication that's potentially dangerous like that they find a safe disposal place. Okay, now we have, there's pharmacies that do take it back as long as they have the safe disposal kiosks. There's also police departments that take it back. The biggest thing is properly disposing of it and getting it out of potentially getting used by somebody else.
That does not mean flushing it down the
toilet. No, that does not mean flushing it down the toilet.
Not mean throwing it into the garbage. I know that there is, through the Health Project here in Muskegon, that they do a couple times a year medication take back, but I believe that many of the law enforcement and fire departments will take that at any time. And as you said, many pharmacies will do that as well.
You have to, it's a very controlled process. Most pharmacies can only take it back if they have specifically designed kiosks or if they have a take-back day, because there has to be an officer or somebody there with that disposal process.
Yeah, it's really a shame that we have to get to some of that, but
I know.
I think so many of us growing up just thought, well, we're done with it, we just flush it. Well, oh my goodness.
Yeah, it's not good for
that. No, that's horrible into our water and leaching into our, ground if you're throwing it out. And the same thing with the contamination for us and animals is pretty outstanding. So we've got about a minute and a half left. What other final words of advice do you have for our viewers?
I think the biggest piece is get to know your pharmacist. Your pharmacist is really a vital part of the healthcare system. They can help you with many things outside of drugs. They are trained in learning disease states. They come out of school very clinical experts in disease states as well as the medications that go along with those disease states. So they're a wealth of knowledge, not just from drugs, but also the diseases and what you can expect from a disease as well. So I think that the biggest thing I can say is get to know your pharmacist, build that relationship. They can really help you with your health conditions and your overall well-being.
So maybe even get to know them before you have a situation where you need to. Just find a time you go in there and it's slow, and I can say, hey, Ben, I'm Lisa.
100%.
I've got this prescription, but as we get older, we know there's a pretty good likelihood we're going to have more than just that one prescription.
Unfortunately, yes.
That is unfortunate. Well, we're lucky that we have all the brilliant people who've come up with all these things that help us out. So.
For sure.
So we'll remind people, get to know your pharmacist. Try to do that on a regular basis. If you can't remember any of the information or things like how can I get help with signing up for my Medicare, my Part D, you can always call 211. That's always a great resource for you. They can give you assistance. They can connect you to us. They can connect you to Walgreens. They can do all kinds of great things or wherever. Thank you, Ben, for joining me. I think this has been great information for me and certainly for all of our older adults and those people who care for them. I really appreciate you sharing the ways that they can help save money and be healthier.
Thank you for having me. I really enjoyed it.
So thank you for joining us this month. We hope we'll see you again soon.